This is our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. I'm Dr. Vidal. We are here in Miami, Pure Plastic Surgery. And today we start February with this group of videos that I'm very, very excited to share. Starting the first one with me, and they're called Provider as Patient. So some of my patients know, some others don't. A lot of people ask me if I've had plastic surgery, and I did last year. I had plastic surgery done 8 years before, Lipo 360, and then last year I decided to do my Miami Makeover, but in my case was a Miami Makeover. And there are a lot of things that I learned from this process and that I think have made me a better physician because I can connect with my patients in a very different level and more personal level. So I wanted to share my learnings and my experience so it may help some patients through their journey. This series of videos is not going to be as focused on the medical aspect of things or indications for surgery, but more of the things that I learned in my recovery period that may help someone and how I experienced them. Okay. So let's start with the procedure. Why a Miami Makeover? What's the difference between a Miami Makeover and a mommy makeover? It's the belly part. So a Miami Makeover, it does not include a tummy tuck. A Miami Makeover is a breast procedure, Lipo 360. So I had Lipo 360 before, like I mentioned, and I have some loose skin, but very minimal after the pregnancy. So I was a candidate for a Miami Makeover, so I could do a Lipo 360 with the breast procedure. Patients that have a BMI less than 24 are good candidates because we're not going to pass a limit of 1 liter of fat removal with a Lipo 360, and that's why we can combine it safely with the breast procedure. My surgeon, Dr. Earl, here at Pure. Why? Because I trust him with my life, literally. I've seen him work. I worked with him. I know the type of surgeon, human he is, and I trust the entire staff from pre-op, anesthesia, post-op, so I didn't want to go anywhere else. So I did it here with my family in Pure. One of the things that was very hard, yes?
Una cosita.
Okay.
We got disconnect on Instagram, so if you can explain again the topic.
The topic?
Yes,
okay.
quick, briefly, we go offline.
Okay.
We're back.
We're back. So for Instagram, I'm starting a series of videos called Provider as a Patient, and today I'm going to start with my story. Provider as a patient, so my perspective as a plastic surgery patient. And how this changed me as a provider and helped me connect with my patients more. So I had a Miami Makeover, which is a breast lift and Lipo 360. So I did the surgery, like I mentioned here at Pure, because I trust my team and literally with my life. So I did it here. And one of the things that was hard for me was when to do it. You guys all know I have a 2-year-old, so planning a surgery with a toddler or a baby has a lot of stress involved. We as moms want to control everything, and in the recovery period, you need help. You need another person to help you with the caretaking of your child, and you need caretaking, okay? So when is the right time? That's a very personal decision. For me, I decided for him to be more mobile. I don't know if that was a good idea or not. Then he's like a lot mobile. But I brought my mom over from Puerto Rico. She stayed with me 10 days to help me. And I had the nanny taking care of him. And my husband, he was working, of course, but in between, he helped me and with the baby or with my caretaking, okay? So this is something that you need to plan. And having someone else either stay with you or especially the nights, I think that was the most challenging, the bedtime, because he's very attached with me in a bedtime routine. So it helped me transition doing it with my husband and then my husband doing it. So it wasn't a shock that all of a sudden I'm not doing the bedtime routine, like reading the book, getting in the bath, and putting him like in and out from the crib. That helped me. Help and having that transition. The other thing that helped me a lot was planning everything from before. Massages, having everything ordered before from Amazon. What are the things that helped me? I had some, like, of course, Gatorade, Pedialyte, water, pineapple juice. My mom did this pineapple teas. So you like put the pineapple, boil it, and that sort of water that comes with the boiling. I started drinking it even warm, also like with ice later on, and it was very good with just a little bit of sugar just for the taste. And it was very good. It helped me hydrate and also with the inflammation. So all those things helped me a lot. First day is rough. The pain was controlled, of course, with the pain medications, but you feel sore, beat up, but having all that prepared from before help us kind of move along those first 24 hours. I had, of course, we all say that if you're in the medical field, your risk for complications increases. So if you're a plastic surgeon, your risk of complications is 20-fold. So I did have some hiccups. What were the things that I experienced in my post-op? I had a lipoburn. Lipoburn is an area that doesn't have good blood supply in the skin. So that means I had prior lipo, so I had some scar tissue from before, and probably from that manipulation to trying to break that scar tissue, then it compromised the skin blood supply. So what does that mean? I couldn't wear my faja post day one. I had to wait a couple of days for the circulation to get better in that area. So it was rough because I was very swollen, and that complicated the recovery, meaning the itching was worse, and I felt very tight in the skin. So definitely I can connect at a deeper level with patients that have that complication. It's something that can happen to anyone. We all do everything in our power to decrease complications, but they're never zero. So I think the hardest part was managing the inflammation. So the low sodium diet, the pineapple and the pineapple teas helped me a lot. And to be patient, right? Like, it's very hard to explain, but of course I knew all the knowledge of it, but it is very different when you live through it. And the emotional roller coaster, it's true, it's 100% true. Even I went through it. You've heard me talk about it. I've heard Dr. Earl talk about it 1,000 times. And we all say it, oh yeah, it's an emotional roller coaster. It is. I remember some day 4 or 5, crying to my husband saying, why did I do this? Why, right? And Willie saying he did too. And spoiler alert, Willie's gonna be in my this videos. So don't miss one of the next lives that Willie's gonna be in this live, he's sharing his story. So you're not alone, right? When you're going through that, we all go through that emotional roller coaster. But having a good family support or close people, one of my best friends, I did lipo to her a couple years ago, and she came to my house. She's the best, Ana Maria, I love you. She came to my house, scrubbed arnica all over my skin so I could feel better, and helped me get in my faja. And all those little things help a lot. And then, of course, I'm extremely happy now. I'm super happy. I am glad I did it. I'm wearing things I wasn't wearing. After breastfeeding, my breasts weren't the same. They were deflated. I didn't wear the shirts or the dresses that I wanted to. And I feel extremely happy now. But that process is part of it. You're not alone. We all go through it. And when I say it, sometimes it feels like, yeah, she's just repeating stuff. But it is like from the bottom of my heart, it is an emotional roller coaster and we all go through it. And then later in my recovery, a lot to my patients is the arnica. The skin gets very tingly, very itchy, and the arnica and hydration and moisturizing the skin, giving it a little bit of time prior to putting the foams helped a lot. Also using a cotton cover just over the skin. There in the faja store, they sell this stretchy faja. It is like an inside bodysuit. That helped me a lot with the itching and sensitivity. So I would wear that, then the foams, then the board. The board for me was essential in the recovery because it helped stabilize everything. And actually the faja, it was more uncomfortable to wear it without the board. The board helped me a lot. So I always am using that kind of cover over the skin, the foams, the board, and then the faja. And plan to be wearing oversized things for those first 6 weeks because everything looks bulky. It's good to kind of cover, but even the pants or the dresses, they look bulky. So I was wearing a lot of like oversized jackets to hide so you don't look very bulky in the foams, boards and everything underneath, okay? Then later on, you can plan all you want, but sometimes life throws curveballs at us. And I had flown my mom over, the nanny was working, Juan was helping with bedtime, and then a few weeks after surgery, Marco had a medical emergency and I had to pick him up. There's no way I had to pick my baby up, and I ended up having a wound dehiscence in my breast. Very scary, because I thought I was going to lose the implant. It was big. It wasn't anything from surgery. It was life, and that happened to me. So I had to then do a lot of wound care to have the breast healed. Unfortunately, healed, nothing else, but it took 3 months to heal. And when I'm now talking to my patients that develop wounds, which is a possible complication of any procedure, breast specifically higher, and also massive weight loss patients, especially arms, thighs, have a higher rate. It takes time and sometimes it gets frustrating because you don't see a day-to-day improvement. What helped me was to be taking pictures and be seeing the week-to-week progression. You see progression from week to week, you're not going to see progression from day to day, and focus on that. It's a very mental process. What also helped me, and of course I am a board-certified general surgeon, board-certified plastic surgeon, and did an extra year of burn and reconstructive surgery, which basically I was managing wounds for a year. I'm like overqualified to treat a wound, and it does get stressful and you get impatient. What did it help? My process with managing this wound to get it to heal. Number one, avoid tension. So what I did was I rolled an ABD gauze, which is a pad that is a little bit thicker, and put it in the bottom of my breast, and then the surgical bra. I wanted this implant to look high at the beginning because I don't want the implant to be putting any tension on the wound. Any tension on the wound is going to complicate the recovery and make it heal less or slower, right? It's going to take longer to heal. So that I think helped a lot. The other thing is, some people think that drying the wound is going to get an eschar and it's going to go faster. The reality is we don't want the wound to be soaked very mushy because that's not good and that promotes infection, but we don't want it dry either, okay? It's a balance. For the wound to epithelialize or form new skin over, it needs to be hydrated and moist. It's not that it's piled with secretion, that's not good, but it can be dry. So even open all day, it's actually not good. It's not going to heal. What's going to do is it's going to form the eschar. The eschar is going to fall off and you have an unhealed wound underneath, okay? So you want to keep the moisture. So that's why either we use, depending on the stage of the wound, we use different different wound care things. If it's either mupirocin, which is an antibiotic ointment, we use silvadine, which is a stronger antibiotic ointment. We may use a wet to dry, which eases on debridement locally on a wound. We may use another product called Santal collagenase, which is a local debriding agent that helps also speed up and debride locally without affecting wound healing. The other thing that I used in my recovery was Duoderm patches. Duoderm is a type of dressing that seals the wound and helps keep the moisture in without getting macerated. So it's very good. What I did, and you can find this on Amazon, what I did is using Medi Honey, which is also fine on Amazon. You can find it on Amazon, and it protects the wound from infection, but it creates that moist environment for the epithelium to grow. So I was putting Medi Honey and then putting the Duoderm sealant and changes once a day. And it was very good because everything was controlled. Then the ABD pad to decrease the implant pressure, so the implant was kind of pulled up by that, and the surgical bra at all times. Took a long time, took 3 months to heal, but it healed, okay? And that's the combination that you want when you're looking for wound healing. Of course, any wound, we're gonna guide you throughout this process, but know that it's gonna take time, and looking at those pictures week to week, you're gonna see that slow but steady improvement, and it's gonna reassure you that you're doing the right thing, okay? What else? The Vaser was great for me. I felt very good afterwards, looking or talking about blood loss, and I didn't feel like lightheaded, weak like that. I was, of course, hydrating a lot. Eating is very important. I didn't have a lot of appetite, but eating and trying to eat twice a day in like small meals helped me a lot. Protein shakes helped me also to get calories, and all throughout my healing process, the protein shakes helped a lot because we always focus on the wound healing, but the wound needs proteins, so we need to intake those proteins to make our body heal. And then afterwards, after the first 6 weeks, the swelling, of course, I saw a very drastic change, but the itching was very strong at the 6-week mark. Again, the hydration, the moisturizing the skin helped a lot. And definitely after the 3 months that the wound was healed and I was off the faja, I felt back to myself. It is a process. We all go through it, but there's an end that you see and you can enjoy your results. I'll get some questions now.
We have a few.
Awesome.
So how about you remind them this?
Okay, so
Well, I pick the questions.
okay, so before jumping into the questions, there is a promo going for the month of February and March. If you haven't seen it in my stories, I want you to take advantage of it. The reason for the promo is because at the beginning of the year, there's a patient-focused questionnaire that stratifies the Miami surgeons in the best procedures, and I was voted best Mommy Makeover and best reverse tongue tuck. So I wanted to thank all the patients that put me in that classification. I'm really honored. I really take it with excitement, pride that I try to do my best for every patient. So I wanted to give back. The thanks with a free fat transfer to the hips when you're booking a Mommy Makeover in the month of February, March. So please take advantage of it, and thank you for everybody that voted for me. Questions?
Yes. I'm scared of putting implant. Should I just do a with no implants? I'm a cup B mom that was feeding a lot of droopiness.
Okay. So very good question. I have implants, so I can say they're very safe. I wouldn't put anything that's not safe in my body. And I've read all of the studies and I'm very well informed, right? But again, it is a personal decision. It is a foreign body, so if it's gonna give you anxiety and not feel comfortable in your own skin, then right? I don't recommend it, but I think it is the best alternative right now when we want to volumize the breast, which is one of the things that happens with breastfeeding. With breastfeeding, we lose a lot of volume because the density of the breast changes. I was always a very full fibrotic breast tissue all my life. After breastfeeding, they deflated and no fibrotic tissue at all. It was very thin and lost all that volume. So that's usually what happens with breastfeeding, and unfortunately, with fat transfer, we don't get that volume and shaping that we get with implants. So at the end is your choice, but these are the alternatives. Breast lift without implants, it's gonna probably take you a cup size down, and they're gonna not take that round full look unless you add volume, which is the implant. If you're okay with that, with teardrop shape, smaller, then just do a lift. But if you want that shaping and that volume restored, then I would consider putting an implant.
Is arnica tea good to take?
Yes, arnica is great. I didn't mention it, but I was taking it as well. The important thing is some of those teas come with bromelain in it. Bromelain increases risk of bleeding. For the first 48 hours, I would avoid it, okay? But if you have only arnica tea, you can take it from like day one.
Okay. Well, you answer this one is, do you have implants?
I do. I have natural implants, the gummy bear type, and I'm very happy with them. Like I mentioned, I lost a lot of volume and density with breastfeeding, and I'm now to have regained that. My goal was not to increase volume or cup size. I wanted to return to the cup size that I was before breastfeeding.
I've lost 92 pounds. I'm 42 years old. What can I do for my turkey neck?
Congratulations on the weight loss. That is amazing, and that's it's inspiring, and I really congratulate you. It takes a lot. So first of all, congrats. And there are options depending on how invasive you want to be and how severe is the neck laxity. If you have mild to moderate skin laxity, then we can do non-invasive procedures, or less invasive. We're talking about non-invasive like morphine, which is microneedling with radio frequency. Of course, a non-invasive alternative is not going to give you a very drastic result, but avoids the scars. We have freestyle, which is a cannula with radio frequency energy, which is the less invasive alternative. It's invasive, but not as much as surgery, or more invasive surgery. And that one has a little bit more of retraction, but still it's best for moderate skin laxity. If you have moderate to severe or severe skin laxity, then it's better to consider a neck lift or a face and neck lift. The alternate or the decision to do will depend on how is your face. So we don't want a tight neck with droopy face, because that looks unnatural and uneven. I have a lot of patients that come, it bothers, my neck is the only thing that bothers me. Yes, but if I tighten your neck and you have jowls and deflation of your cheeks, you're gonna look very unnatural. So it's better to do a full facelift, okay? I can surely evaluate your case and let you know.
Okay, the same patient says, thank you, I still have 100 more to go.
Wow, but you're gonna get there. You're almost halfway, so congratulations and keep on it. Consistency and focus, you've got so far, you can definitely reach your goal.
Hello, what's a BMI requirement for Miami Makeover?
Good question. So my BMI upper limit is 33.5, but I do encourage everyone to try to get to a BMI lower than 30. The reason for that is to decrease complications, infectious complications, wound healing complications, and blood clot, which is deep vein thrombosis or pulmonary embolism, which can be very hurtful. So those three decrease once you get to a BMI less than 30.
Okay, hi, can you explain what a transfer to hips is?
Of course. So basically, a BBL or Brazilian butt lift is lipo 360, and then fat transfer to the hips and buttock, right, for shaping. When we're doing a Miami Makeover, I can't lipo 360 because there's a blood supply issue in the abdomen, and also there's a limit of fat that I can remove when I'm doing a Miami Makeover here in the state of Florida for safety reasons. So I can only remove 1 liter, which is basically like the flank area. And that combination is great to add fat transfer tips. So when we're doing Mommy Makeover, let's say that's your waist. I'm repairing the muscle here, and these are the legs, right? I'm repairing the muscle which cinches the waist, and then I'm doing the liposuction in the waist and accentuating that waist for the tummy tuck part. But then we may have hip dip, or the hips may be a little flat. The option is to use this fat that I removed from the waist area and transfer it to the hips to complete that hourglass shape and accentuate the waist even more. So that's the possibility when doing the Mommy Makeover.
Okay, we have 1 minute, so one last question.
Really choose wisely.
Okay, you know what? There are 4 people asking about the promo, so let's remind the promo.
Okay, so free fat transfer to the hips with MMO, Mommy Makeover, and it's only for cases booked for February and March. Okay? There you go. Promo. Okay, you guys, I hope my experience helped someone out there get through the process. A lot of people say, do your research, and something surprised you because you didn't research enough or you didn't read enough. I'm a plastic surgeon, and I had talked about all of the things that I went through, and it still shocked me. So it's okay, you're a human being. There are things in recovery that it's gonna take you for a surprise, and it's like it's okay to go through that, and it's okay to feel the things that you're feeling. Just remind yourself why you decided to do it in the first place, and that it's temporary, and you will feel better in a few months, okay? I'll see you guys. What?
Oh my god! I can't believe you answered my question! I see you in July!
Love it.
I don't miss it.
I love
I'm
it.
attracted. Oh, what's this? This is the second time I read the same question. I'm sorry. Do you do FBL?
Fleur-de-lis. Tummy tuck. Yes, I do. Yes, I do. I actually have one tomorrow, so I'll share a story tomorrow talking a little bit about fleur-de-lis tummy tucks. But definitely, I do. I try to avoid it because I don't want that extra scar, but there are some patients that would benefit from it. And I talk a little bit about that tomorrow in the stories, so don't miss it. Thank you so much. Don't miss next Tuesday. I'm going to have a surprise guest. It is a provider from the clinic, and she will be talking about a different procedure that she did and the things that she learned. So don't miss it. See you guys next Tuesday.
Bye!